Ever Googled prolapse and instantly regretted it? Let's break it down. Without the horror stories, even though I am a big horror fan, but not in this case. Pelvic organ prolapse is one of the most common things that I treat as a pelvic floor physical therapist. What it essentially is your pelvic floor's inability or difficulty supporting your organs. So if we look at a pelvis, this is what a pelvis looks like. So we have the rectum in the back, the uterus if you have one, and then the bladder in the front. The pelvic floor, all this musculature supports all of these organs. Over time, just like any muscle group, your pelvic floor can become weak, it could be tight, it could become a combination of both, and it could be not the best at withstanding pressure. So if you're holding your breath, if you're bearing down, if you're coning your abs out, these all add pressure to the pelvic bowl or the pelvic floor and the organs, and your pelvic floor needs to really overcompensate to accommodate for this. What happens over time is these muscles become weak, and then it can't support these organs very well. And what this might feel like is a heaviness. Some clients say it feels like there's a full tampon inside of them that the sensation just will not go away. Over the course of the day, as your pelvic floor gets tired, the symptoms become more apparent. So it might not happen until the end of the day. It might not happen until you've been on your feet for a certain period of time. And you might especially feel it when there are activities you're doing that increase that intra-abdominal or pelvic pressure, like pooping, like lifting, like jumping. If we don't have the best abdominal and pelvic floor support doing these activities over time, this causes a weaker pelvic floor and could contribute to prolapse. What I want you to know is if you are experiencing prolapse, your organs are not falling out of you. Even if you're seeing something, what you're most likely seeing are these muscles that are supporting the organs that are coming out towards the vaginal opening. It's kind of like the trampoline effect. So if this is your pelvic floor or a trampoline and this is you or your bladder, and you have something like a cystocele, which is a bladder prolapse, bladder is weighing down and your pelvic floor is kind of sagging, for lack of a better description, just like a trampoline sags when you're standing on it, and you're looking at it from the underside. So you're seeing the muscles, you're not seeing the bladder. And not every prolapse is created equally. There are different grades of prolapse, and depending on the grade and your response to more conservative treatments like physical therapy, surgery might be something to consider. The lesser grades, sometimes the prolapse can reduce with breathing mechanics, pelvic floor strengthening and flexibility, conditioning exercises, and abdominal exercises, hip exercises. Basically like a total body makeover like we would do for any other pelvic floor woe. There's a lot of misinformation regarding prolapse out there, and I want to reduce the myths and the fear and everything surrounding it. And we are doing that throughout the month of July on this page where I'm talking all things prolapse, so make sure to like, share, and follow.